Dreamers plant trees. To be healthy with lasting roots, a tree must be tended and nurtured. After many years, that tree will soar to great heights and produce abundance for current and future generations. So it is for SAY San Diego. Dreamers founded SAY San Diego, and it is well-rooted, well-tended, and growing stronger every year. In 1971, youth advocates planted the SAY San Diego dream in a small office shared by Bayside Settlement House in the Linda Vista neighborhood, staffed by volunteers and financed with just $1,500 at first. SAY embodied the key idea that youth risk can be prevented when youth, families, and community work together to find solutions. The first 10 years of SAY's history were filled with inspiration and growth. SAY grew to open 3 neighborhood resource centers in Linda Vista, Claremont, Kearny Mesa, and Tierra Santa. Each center had youth and family counseling, alcohol abuse prevention, tutoring, and emerging community organizing. SAY became a trusted civilian partner to the military by supporting active duty families and their children. SAY also began lasting partnerships with the City of San Diego and with the County of San Diego. In the 1980s, SAY was known for proving that prevention works. We demonstrated that youth who are vulnerable and troubled can be prevented from becoming youth in trouble. We broadened our scope to serve working families and latchkey kids, starting with the partnership with San Diego Unified School District to conduct before and after school programs at 2 elementary schools. In coming years, similar programs blossomed across the entire school district in dozens of sites. To this day, SAY's extended learning programs offer homework and academic enrichment, recreation, positive peer culture, and support for the everyday needs of families related to food, housing, transportation, and more. SAY increasingly emphasized restorative practices for youth. Due to our proactive approach then and now, more than 90% of youth at risk of delinquency served by SAY do not enter or re-enter the justice system. By the 90s, SAY gained national attention for our holistic approach to meet multiple, often complex needs of youth and families, versus just focusing on a single need or symptom. As SAY turned 25, we promoted a collaboration-first philosophy, convening diverse coalitions devoted to community-driven solutions. These included the Military Family Cluster, now known as the Military Family Collaborative, North Claremont Coalition, the Parent Alliance for School Standards, Southeastern Collaborative, and Mid-City for Youth, now known as Mid-City CAN. Outgrowths of these collaboratives and newer ones still work together today to improve community life. SAY used its abundant strengths in the 2000s to expand critical support for underserved populations, including homeless children, foster and kinship families, and immigrant and newcomer families. SAY infused new, evidence-based practices into our programs. And we organized public health coalitions in many city neighborhoods to prevent use and abuse of alcohol, tobacco, and other drugs. SAY has become exceptional at involving youth, parents, residents, businesses, and many others in creating supportive social environments. SAY San Diego grew as the city and county grew, evolving to serve youth, families, and communities, citywide and countywide, with trusted, welcoming family resource centers, school-linked and community-based programs, and neighborhood coalitions. Given the enormous importance of early development for all aspects of a child's future, SAY began a home visiting program for vulnerable parents, from the prenatal stage to the child's 3rd birthday, and expanded our preschools. We believe we have truly made good on SAY's commitment to opportunity, equity, and well-being for our neighbors and local communities, as more children and families have access to health insurance and health care. Smoking and drug use among youth have decreased, rates of teen pregnancy are down, youth are far less often arrested and entering the justice system, and fewer children experience child abuse and neglect. Yet, there's more to do. Safe and stable housing is unaffordable for many families. More children and families are experiencing poverty. Children and teens have many unmet mental health needs. Vaping, e-cigarettes, and other substances are aggressively marketed to youth. early childhood services remain scarce and financially out of reach for many parents. So, SAY will continue to meet the moment. Recently, we have opened our first workplace childcare center, launching a project to inspire other employers to provide childcare for their employees, greatly expanding our early home visiting programs, begun a new healthcare access and wellness initiative, launched a mental health center, and expanded our community-based prevention partnerships. Throughout the COVID-19 crisis, we stayed on the job, creatively teleworking and pivoting quickly to keep our programs and services moving forward, while also raising hundreds of thousands of dollars in emergency relief for families experiencing hardships due to job and wage losses and illness. Over 5 decades, SAY has served more than 2 million of our San Diego County neighbors. Dozens of talented and dedicated board members have guided our way. Thousands of generous community-minded donors and grant-making partners have fueled our success. SAY San Diego is all of us and all of you. We could not have done this valuable work without community partners, devoted employees, and all of you.